Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. Hello, and welcome to the Healthcare CEO Podcast. I'm your host, Daniel Fernandez. With me today, I have a very exciting and distinguished guest. His name is Dr. Charles Lockwood. He is the Executive Vice President of Tampa General Hospital. He's the Senior Vice President of USF Health, and he is the Dean of Morsani College of Medicine. Although Dr. Lockwood is extremely knowledgeable on a variety of topics, we're going to focus on two major highlights that we're going to discuss today. One of which is the guiding principles that have helped drive his decision-making, especially during this time of COVID. Secondly, the transformation, just a huge amount of transformation that's taken place over at USF over the past 4 years, and it has been extraordinary. That, Dr. Lockwood, welcome to the show.
Thank you.
So let's kick things off with, obviously, COVID is a very hot topic these days, but let's talk a little bit about sort of the guiding principles that you have in place and how they've helped move things along over there.
Yeah, well, I would say obviously our first guiding principle is the guiding principle that every physician should have, which is patients first.
Yeah.
But in this particular case, it required, I think, a level of nimbleness and audible calling that is a little bit unusual in healthcare. And we really kind of confronted a series of challenges. The first was the challenge that so many other centers faced, which was not having enough PPE and not having actually the collecting swabs that you need in order to do viral testing. And that was because early in the epidemic, the center that made, the company that made the polyester Dacron swabs that were used for viral collecting actually were closed. They were in Italy. So I had literally in the first week asked my radiology department that was very skilled at 3D printing to see if they could create a 3D swab, a flocked nasopharyngeal swab. And within a week, they had a prototype that they tested, turned out to have viral recovery similar to the commercial product, actually a little better. And I was told about 3 weeks ago that 40 million of these have been made worldwide.
Wow.
So that was a pretty good, I would say, nimble response to the crisis. Other things that we did were we set up the testing sites for the county, using a lot of volunteers, students, et cetera, and often in very high temperatures, and I was very proud of my team. In the hospital, within about 2 months, we had set up 27 separate clinical trials at Tampa General Hospital, testing everything from remdesivir to most recently a pediatric vaccine trial. So, and really extraordinary efforts made by our faculty there, the intensive care docs, the ID docs, sometimes working 6 weeks straight and never complaining. Really heroes, real heroes of this story. I think that another example was we set up a continuity clinic for the county. So anybody that was tested positive would be followed with telehealth with it could be our physicians, sometimes our medical students, and they'd be called twice a day, and then we might triage them into the hospital or just staying at home. And occasionally we'd measure their level of oxygen saturation, their blood pressure, their temperatures. We called that the COCO clinic, the COVID continuity clinic. And that was literally thousands of patients that have been followed in that clinic. So a lot of different things that we did. Another example was setting up telehealth. We had talked about it for 5 years, and obviously this crisis forced our hands, and of course we were also able to bill for it for the first time. And so we were able to set that up in a week, and we've now done over 100,000 telehealth visits. So, I think nimbleness, the ability to be incredibly agile and respond very, very quickly were the hallmarks so far of how we've dealt with this horrible pandemic. But I'm incredibly proud of all the folks at USF Health and Tampa General that responded so well to it and worked so hard, continue to work so hard.
Yeah. Do you feel as if telehealth is one of those things that is a fad, or you think it's here to stay?
Oh, I think it's here to stay. Absolutely.
Hmm.
I have been using it actually for consults. And initially it was for consults and patients in Florida, but now I've consulted with patients in California, slew of patients in New York, and I've actually lost track, a couple other states too. But so it's really opened up our opportunities to provide care, and patients love it. Very, very high patient satisfaction rankings on our Press Ganey survey for our telehealth setup.
Wow. Do you feel as if, because I know you previously just talked about the radiology department pitching in, do you feel like everybody sort of pulled together during this time?
Literally, I would be doing testing in these outdoor testing sites for the county, and I'd be with a physical therapist. I might be with a nursing student, a couple of students that were part-time students for us that work part-time in nursing and other hospitals. And our administrators did all the clerical work at these county testing sites. And it was sad that we were having to do it, but it was also kind of fun. And in so many ways for healthcare, this has been our version of World War II. My father used to tell me these amazing stories about all the events that occurred to him during the Second World War. And sometimes there'd be almost a gleam in his eye that it was an exciting time for him, and obviously a tragic time as well. This is very similar for healthcare. This is our version of that. And so a lot of the innovation that's been generated has been generated because of the urgency of the situation and because so much was not known at the beginning and still not known today.
Under your leadership, you were, it seems, adequately prepared. Did you ever have any issues acquiring, ventilators or anything like that? I mean,
well, we had the advantage of a little bit of a delay here in Florida. So we
okay.
saw what was happening in New York, in the Northeast, and we began to earnestly collect PPE. We even were very quickly realized that we need to be able to sterilize it with UV light and gas sterilization of our N95 masks. And we began stockpiling that. John Corus, the president of Tampa General, ordered 87 new ventilators. I thought he was crazy, but he was way ahead of the curve on that. We set up the ability to flex our ICU capacity there such that we never were overwhelmed. And we were one of the busiest centers in Florida because we're obviously a quaternary care center, and we received very, very sick patients from all over the region. And I had quite a few patients on ECMO, et cetera. But we were able to keep our case fatality rate in the county and at Tampa General very low, amongst the lowest, frankly, in the United States. And I think that part of it was that we were well prepared. Part of it was that we were very early in the game to administer dexamethasone, remdesivir, convalescent plasma therapy, prone ventilation, et cetera. And we happened to have been investing heavily in our infectious disease group. So timing was good. We had built significant ICU capacity and expertise and infectious disease expertise a couple of years before the pandemic hit. So it kind of it reinforces the adage that it's lucky to be smart, but it's smarter to be lucky.
Nice. Now you have had to adapt to a large amount of change, you and your team, in such a short period of time. But in terms of change, you've had a lot of change yourself over at USF, haven't you?
We have. It's change has become, I think, literally part of our DNA. It's been a period of, in many ways, unprecedented advances for the medical school and for USF Health. We've had a huge surge of applications. We've had our most competitive classes 6 years in a row. The curriculum has been revised and improved, and we had record high USMLE scores, really extraordinarily high this last round. We have doubled our NIH-funded investigators. We've doubled our research grants. We've tripled our clinical trial volume, and we've completely revamped our clinical practice over the last 6 years, and developed much, much closer ties to our primary teaching hospitals, obviously Tampa General, but also Moffitt, the Moffitt Cancer Center. So, and those relationships with the hospital have in turn allowed us to expand our clinical practice at a much faster pace than we could have before, implement Epic and improved our revenue cycle and really recruited a lot of clinicians. It's the one good thing about COVID is I hadn't gone to any recruitment dinners, so I've lost a couple of pounds, but it's been an exciting period. And we were probably, because of all that, well prepared for the ability to flex as much as we have during the COVID crisis.
Now you hold roles currently at USF and TGH. Tell us a little
Right.
bit.
Well, so, Tampa General has been our primary teaching hospital since the founding of the medical school. Our first class graduated in 1974. But as with a lot of new medical schools, the relationship was not always harmonious, and it could be stormy. And over the last 6 years, it's improved so much that we've now been able to negotiate a new affiliation agreement where we'll create a single clinical platform and allow us to access Tampa General's capital and to be able to create a common infrastructure for revenue cycle, access, HR, IT, et cetera, while maintaining the independence of the faculty. They still get their checks from the University of South Florida, but allow us to be able to expand even faster than we have been already, and to really develop outstanding quaternary care clinical service lines, and also to be able to expand our accountable care organization, build primary care, and actually provide better service to our referring docs so that we can be sure that we can see their patients more quickly and get back to them more quickly and so forth. So that's been a really exciting exercise. It was very complicated. We're a state university. They're a private, not-for-profit hospital. So it took about 2 years to work through all the details of that new, much tighter affiliation. And we had to get approval from not only our boards of trustees, but also from the equivalent of our Board of Regents. In Florida, it's called the State University System Board of Governors. So we were able to work very, I think, well with everyone, and a lot of lawyers, and come up with a really sound plan that allowed us to do all the things we needed to do from an academic standpoint, but gave us new resources to continue our pace of expansion.
I think there's a lot other organizations around the country can learn from this. I mean, I would expect that from this, relationship, we'll be able to deliver a better level of care. Is that correct?
Yeah, I think that's very, very true. The old adage is, if you've seen one academic medical center, you've seen one academic medical center. And certainly we had our own constraints. We had to protect a whole variety of different endpoints. For example, a state university can't pledge credit to a private concern. So we had to build a structure that avoided that constitutional issue. We wanted to protect sovereign immunity. We wanted to be able to make sure we didn't have any Stark or antitrust issues. So all those things kind of got constructed into the agreement in a way that afforded many protections, but allowed us the flexibility to do what we needed to do to go to this next stage of our relationship, and to, frankly, to gain the kind of capital and the ability to take a little more risk than a standalone practice within a university could take. So we think it's a really good agreement, and we think that it probably would be a good model for other public medical schools that are closely affiliated with a large tertiary care hospital.
And again, obviously you've led such a large amount of change thus far. What does the future hold? What is it looking like?
Well, yeah. When I think back on the last 6 years, it is a bit of a blur. we have to implement all this. So we have a lot more to do. We've moved up on our U.S. News rankings considerably since I got here. We were languishing around 80 for many years, and we've moved up to 47. We're second in the state on the heels of our great colleagues at the University of Florida. But we really want to continue that pace of ascent. And we believe that we're not a slave to the survey, but we do think it serves to organize and measure what we're trying to do to advance healthcare in Florida and to try to advance our teaching programs and our research programs. So it's a little bit of a motivator for everybody. And Tampa General is equally interested in moving up on their U.S. News rankings. We're top in the state now, I think, in 3 areas: cardiology and cardiac surgery, GI, and orthopedics. So we'd like to be top in the state in all the categories. So lots of work to do.
But being top in the state wasn't always the case when you got there, right? I mean, you've done a lot on the patient side of things as well. These scores didn't just miraculously happen overnight. So
yeah, I said pretty early on that, we were in the customer service business and our customers were our students. And we think our students are doing great. So give ourselves an A- for that, maybe an A. And our patients. And we were keenly interested in being able to assure that not only were we giving them great outcomes and high value for their care, but that they were really satisfied. And we hadn't measured patient satisfaction for a decade before I came, and we implemented our Press Ganey surveys in the last quarter of 2015, and most of the metrics on that survey have increased either 3 or 4-fold. So we're, in many areas we're in the 70th or 80th percentile, and so that's taken a lot of work, customer service training for our staff, a lot of work with our physicians to improve their communication skills, although they're great docs and they're Florida friendly, but we had to work on that, and it's paid off, I think, significantly. In quality, we were very proud that our first macro score from CMS was 100. I joked with Terry Ashmead, who runs our quality programs, wonderful neonatologist, that okay, Terry, now you have to keep getting hundreds. So, and she got a 95 this year, so she's still doing okay. But we're very proud of the level of quality at both USF Health and Tampa General. Tampa General's had its own quality journey that we've been hopefully an integral part of. And I know that John Corus is equally proud of all they've accomplished in terms of leapfrog and their Vizient scores and so forth.
Yeah, when we spoke last week, I mean, this is an extraordinary amount of change in such a short period of time. I mean, you compared it to going from like a horse and buggy to basically equivalent of like a high-speed rail, and that is commendable. And that,
thank you.
Yeah. With that, I've got one more question for you I'd like to ask. There are a lot of CEOs and leaders that follow this podcast. And if you could give them advice today, what would you tell them?
Well, I probably don't need to tell them anything because they probably know it all already. But, I think that one of the keys to our success has been that this is really all driven by consensus, that we really worked hard at creating a vision in all of our mission areas, in our educational and training area, our research area, and our clinical area. And we really built a strong consensus around that, not just among the leaders and the chairs of the departments and the administrators, but among the rank and file, the staff, et cetera. We have lots of town halls. I make rounds in every unit. John Corus literally walks every corner of his hospitals. I remember making rounds with him and he started talking to one of the housekeepers and seemed to know more about her family than I could possibly know. And I said, John, you're amazing. You really, and he said, no, that's what leaders do. And hopefully we do the same on the practice side and in the medical school. But, feeling that it's a family, and we laid off no one during the height of the crisis with COVID. We had no layoffs, and we were able to spring back such that our volumes are actually higher than our pre-COVID volumes in terms of in-person visits. Of course, we've added telehealth, which is a bonus, but our surgeries are also ahead of our pre-COVID time. So not having to lay off anybody and being poised and ready to spring into action really made a huge difference. And having a great partner like Tampa General was one of the keys to doing that. And I know that Moffitt, the story is almost identical there, just amazingly agile in their responses. And we're proud to have them as part of our family as well.
Wow. Thank you so much for sharing your knowledge today. It was an honor to have you as a guest, and I know there's a lot that people can learn from today's podcast.
My pleasure. Thank you very much.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.